Now, October 24th is UN Day, and this year it is 75 years old. UNAIDS, the UN agency working to stamp out HIV and AIDS, turns 25. Despite decades of scientific advancement in the HIV response, progress remains, well, one would say uneven, with some countries rapidly reducing AIDS-related deaths and new HIV infections, and others seeing increasing epidemics. Now, to discuss this further, we're joined via Zoom by Dr. Mbulawa Mugabe, UNAIDS South Africa Country Director. A very good afternoon to you, Doctor. Thank you very much indeed for taking the opportunity.
Thank you, Blaine.
So let's get a sense of what we're dealing with here. Talk to us about the continued importance of South Africa's participation in the United Nations and to the global AIDS response in particular.
As you rightly said from the beginning, 75 years of the UN Charter and the formation of the United Nations, and it's also 25 years of UNAIDS, which is the United Nations Joint Program on HIV. This program actually is a program that brings together the resources and energy of 11 UN agencies that are coming together to work on a common cause, which is HIV/AIDS.
Right.
This is the future of the UN in terms of its reforms to get UN agencies to come together and work with member states around common problems so that we can make movements.
Well,
it's almost 40 years into the AIDS epidemic as we speak.
Right.
And of course, AIDS was came a little bit much earlier than that. And as you said in your introduction, we have had progress. But that progress is very uneven across regions, across countries. And I think in the main we have had a peak, but it remains a major and ongoing public health emergency, just like COVID.
So there's a new dynamic, as you mentioned now, COVID-19, dealing with HIV, AIDS and TB on one hand. On the other hand, we're dealing with a pandemic, a COVID-19 pandemic. How has the coronavirus impacted on the efforts to contain HIV/AIDS on the continent in particular?
I mean, COVID has actually disrupted our lives in multiples of ways. In fact, there's hardly any sector or any aspect of our lives that has not been disrupted by COVID. But particularly when it comes to HIV, I think the disruption has been in terms of us losing grounds on a number of targets that we have committed ourselves. And South Africa is one of those countries that has been at the forefront of the global AIDS response. South Africa has about 20% of the global epidemic, both in terms of new infections and people who are on treatment. But at the same time, it is the country that is making the greatest progress. Although, we remain with major challenges that needs to be addressed. We have about 7.5 million people living with HIV in South Africa alone. And of those, we still have about 2 million of them waiting to go on treatment.
Right.
So what has happened during the COVID pandemic is that we have lost the grounds in some of the areas where we are making enormous progress, particularly in some of the targets, like, for instance, putting people, making sure that people get tested, making sure that those that are tested are put on treatment, and that they are retained in care and have their viral load suppressed. So we've lost grounds on that. I must also hasten to say that we're already struggling with some of the indicators even before COVID. So going forward, I think we really need to do a lot of catching up, as we need to do in other aspect of socioeconomic development in South Africa that has been disrupted by COVID.
We are learning, and when I say we, it's not only the normal people on the ground, but also the scientific community learning every day about COVID-19. What's the latest research and data currently available telling us about whether HIV-infected individuals are more severely affected by COVID-19?
I think one of the things that I think we can say about South Africa is that South Africa has been able to deploy the infrastructure that we have from HIV for the COVID response. If you look, for instance, at the Ministerial Advisory Council and you look at some of the leading scientists there, those are people who are at the cutting edge of HIV research and response. So we have actually managed to leverage HIV to respond to HIV. But coming specifically to your question, there is evidence that, of course, people living with HIV are at a much more elevated risk of getting complications from COVID. We have seen that from studies from the MRC and also from the Western Cape that yes, we need to make sure that we ensure that people living with HIV continue to be on treatment, so that in fact they can reduce their vulnerability. So we have learned a lot, but I think we have also benefited from the infrastructure, as I say, that the scientific community has laid in South Africa. But more importantly, I think for South Africa, I think it's important to bear in mind that the AIDS response in South Africa also has had community at the center of the response. I think that's a very important point to make. It's important in the sense that if you look at what we are being asked to do today by the authorities and by the leadership, that we should stick to non-pharmaceutical interventions. Those are primarily interventions that needs communities to provide leadership to make sure that we do the right things, we wash hands, we sanitize, we wear masks. So it's about what we also learn about how communities can actually respond to a common cause and actually change the face of the epidemic.
And those health protocols, those health protocols, Dr. Mugabe, should have predated COVID-19 in terms of, washing our hands, etc., etc. But, we find ourselves in a situation where it hasn't been, and people are slowly but surely getting used to, washing your hands for 20 seconds. For instance, I didn't know that you need to wash your hands for 20 seconds at least. You normally just, go under the tap quickly and you're out. But we're learning, and I guess it will help us going forward, especially when dealing with issues like HIV and AIDS. Pre-exposure prophylaxis, or PrEP, Dr. Mugabe, as you know, is when people at risk for HIV take medication to prevent HIV. How important is it to make PrEP more freely available? How widely used is it?
I think PrEP is absolutely important. I think it's one of the tools in the box that we have for HIV prevention. I think we could be expanding it more than we are doing at the moment. I think there's an awareness that I think we need to step up this intervention, because I think it's one of the newer interventions that is available for us, and is also particularly important for key populations. For instance, it's very clear that if you look at the epidemic in South Africa, almost 30% of the epidemic is among adolescent girls and young women. And in fact, and if you also look at other groupings, the groups that are called key populations, like sex workers, particularly female sex workers, that are at an elevated risk of acquiring infection, and also other key populations like men having sex with men, people who inject drugs, transgender people. We need to make sure that they actually have access to those technologies that actually, or interventions that actually can suit their daily lives, so that we can get ahead of this epidemic.
When you talk about key populations, especially with regards to young women and girls, we're talking about what, between 15 and 24 years old?
Yes, that's correct.
Right.
And in fact, there's no other age group that has the level of infection that we have in this age group. But again, if you compare, for instance, this age group, and you compare them, for instance, with female sex workers, female sex workers, multiple, infections compared to this group that has the largest infection. So we really need to make sure that this, again, in the spirit of the Sustainable Development Goal, that we make sure that no population is left behind as we respond to this epidemic, because that's the only way we are going to reach the Sustainable Development Goals, because not a single one of them will be reached if we do not address others. In other words, we have to address some of the underlying causes like inequalities, gender-based violence, those kind of mundane things that I think we need to be acting on to reduce vulnerability of women and girls, and also those key populations that I've outlined.
So, Doc, as we wrap up, in order to attain some of those goals, let's be honest, apart from raising awareness, money is needed to make a difference in the fight against HIV and AIDS. Is there enough funding and backing for research for, in particular, this elusive cure that we're looking for?
2 points to make on resources. I mean, clearly we don't have enough resources. In fact, I think the resources to HIV has been declining over time. And of course, now we are going to be even more challenged because we are now dealing with triple epidemics, so to speak, HIV, TB, and COVID. Yeah. And we'll need to marshal resources. And South Africa, at least, is one of those countries that has actually been funding its own response. Up to almost 80% of the epidemic has been funded from the fiscus. But of course, this is going to be a major challenge going forward because of some of the competing challenges that have been necessitated by the disruptions that we have experienced, some of the socioeconomic disruptions that have occurred, some of the social protection measures that needs to be taken to make sure that at least we respond during the post-recovery phase of the COVID pandemic.
Dr. Mbulawa Mugabe, UNAIDS South Africa Country Director, we thank you very much indeed for your time, for your perspective. Great insight. Be well. Good health to you and your family.
Thank you.
All right, there you go. It is UN Day today, United Nations Day today, and the good doctor giving us a sense of where we are in the fight against HIV and AIDS. You can't forget that part when we're dealing with a pandemic as well. So important insight indeed. Well, the Minister of International Relations and Cooperation